So the question that I'd like to address today is, can we cut the federal debt and create jobs by improving health? And this is a question that I've been asking since I read the 2011 long-term budget outlet projection of the Congressional Budget Office. It's not a text I usually read, it's about this thick, but this one shocked me. I'll describe one chart that was very important. This shows years from 1970 to 1985, and this is spending as a percentage of gross domestic product. You can see along the bottom, Social Security is at the bottom. In 1970, we were spending about 4% of GDP on Social Security, and then over time, it's projected to increase to about 6% of GDP. So that's a huge increase, not as scary as what's happening in healthcare. This is federal spending on Medicare, Medicaid, CHIP, and exchange subsidies going from about 1% of GDP in 1970 to about 19% of GDP in 2085. Interestingly, during that time, there's a projection that spending on everything else, the federal government spends, defense, education, everything else, will go from a large portion to a small portion of total federal spending. Now the dark line is total federal spending. The dotted line is revenue. And typically, the revenue and expenses have been close together. During the Clinton administration, we actually had a surplus, which started to end when the tax cuts were passed under Bush. And then the spending line is projected to go way high. The difference between this line and the dotted line is the annual deficit. And you add the annual deficit together, that gets the federal debt. Now, there's actually been some pretty good news lately. In the 2013 update of the CBO, they actually project that medical care costs might be going down, maybe down to about 14% of GDP. We don't know why. Is it the recession? Is it the policies, ACA? And then the report that just came out a couple days ago, even further cuts. And that's only a short-term projection. I think 2015, middle of the year, the long-term projection will come. So what happens? And by the way, it's important to note, this is not a short-term budget deficit problem. This is the annual deficit. Red means bad. Red means we're spending more than we're taking in. But look how the deficit is dropping. It's going to be about 2% of GDP by 2015. That's actually thought to be manageable. The problem really starts in the long term. Now, if this happens, by about 2035, we will be spending double. Our total debt will be double our gross domestic product. We're around 75% now. If we hadn't passed the Obama tax cuts, we would have stayed at around 70 to 80% of GDP budget. But we did pass the Obama tax cuts. So if this happens, what will happen in the United States? Who will we borrow money from? China's not going to lend us money anymore. The American people won't lend us money anymore. I actually think that the United States will not survive as a fiscal entity. I think this will make our economy implode. And if the American economy implodes, what will happen to the world economy? Forget about covering Social Security and Medicare. We won't be able to cover defense or education or anything else. This is a really serious problem. You know, to make it tangible, the people sitting in this room, we owe about $30,000 apiece to pay off the debt. Our kids, about double that amount. Now, what are the health-related causes and why is that relevant to this discussion? Really four relevant things: lifestyle, chronic disease, aging society, and poverty. And each of these lines represents a body of literature. So lifestyle increases chronic diseases. Chronic diseases increase Medicare costs for the people who are on Medicare. Chronic disease also lowers tax revenue because if you're sick, you can't work. Increases Medicaid costs for the people who are on Medicaid, higher rate per person. Poverty and inequality reduces tax revenue because fewer people are paying taxes. It also increases Medicaid costs as more people are covered by Medicaid. Poverty and inequality also increases chronic diseases in and of itself. It also has negative impacts on lifestyle. Aging society increases Medicare costs because more people are covered by Medicare. Also lowers tax revenue because fewer people are paying taxes. It directly increases chronic diseases because people are more sick as they get older. increases Social Security costs because more people are being paid. Yikes, a really serious problem. But the Chinese symbol of crisis, problem, and opportunity. Maybe there's an incredible opportunity here. And the question I'm asking is, can we create jobs and reduce our debt by improving health? And my back of the spreadsheet calculations, if we improve the health of the population by expanding the years that people can work by just 5 months, it'll actually reduce the total federal debt by 1.6%. If we can expand working life by 4.5 years, reduce the total federal debt by 16%. 9 years, 32%. And this is the total debt. It's just not the annual deficit. If we can reduce the annual rate of increase of Medicare by just 1 percentage point, it'll reduce the federal debt by 1.5%, 1 percentage point, 15%, 2 percentage points, 30%. So maybe there's savings here of 3 to 60% of the total federal debt by improving health. These are what I call, again, back of the spreadsheet calculations. I'm happy to share them with you. I have written a couple papers on this. Also will improve the health and quality of life of people, millions of people if we do this. So how might this work? My thought is basically to create a common pot of money that is funded primarily by employers. This is not a government-supported program, but Treasury, through the taxes it collects from employers, insures CMS, which is Medicare and Medicaid, and also state Medicaid services. So the idea is collect money, go into a common pot, and have money flow to all the places people work, live, play, pray, not just the work site. So basically take the best of what Dan has described to us, the best of workplace health promotion, do it in all these locations. And my budget for this is $200 per person per year, which is the budget of the best workplace programs, the programs that save money and improve health. And $62 billion is a lot of money to me. It's about 5 times total spending in public health in the nation right now. It's about 30 times the entire workplace health promotion field, but it's about 2% of what we already spend in medical care, and it's 0.3% of the liquid assets non-farm, non-financial institutions have in the bank. So it's definitely something within our spending ability. And the short-term costs may actually be covered by the short-term savings. Now, I see most of this funding coming from employers, and they're doing it not to be kind. They're doing it to control their medical care costs. The best programs in our field have been able to save more than they cost in workplace settings, but we're not good at reaching spouses and dependents. So the idea here is to fund programs in the community where people are based. And that's the selfish reason that employers might fund this. So their bill is about $34 billion. The Treasury, $2 billion, which comes from taxes, insures about $5 billion. I'm talking about health insurers in a way that I think will be self-funding. The funding for CMS, Medicaid, Medicare at the national level is actually funded through a mechanism I'll tell you in a minute. So this money would flow to all these different places. Now, these numbers I have are basically where people are based. So they're allocated at $200 per person per year. Now, if we do this, if we grow the workplace health promotion field from $2 billion to $60 billion, it'll create about 280,000 new jobs at $75,000 per job, which will stimulate $4 billion in new state income tax, which is enough to pay for Medicaid, and about $22 billion in new federal income tax, which is more than enough to pay for the federal government share of this. Now, is this possible? That's really the question that we need to answer. Thank you for your attention.